Increased stress, anxiety, and depression can affect anyone. However, people living with heart failure are more likely to experience changes in these areas. In this video, we will discuss different mental health states and strategies to help manage their effects. Stress is a normal part of life. There are positive stressors, such as exercise, taking a holiday, or buying a new home. There are negative stressors that can also affect our mental health and well-being. These can include a new heart failure diagnosis, starting new medications, and embracing multiple new lifestyle changes. For some individuals, this can be a lot to digest, on top of not feeling like oneself. Stress can affect how we think and how we behave. When stressed, we may experience some of these changes: trouble concentrating and poor judgment, difficulty making simple choices or feeling confused, crying and pacing, frustration, irritability, restlessness, and even the desire to have a smoke or an alcoholic beverage. If you experience some of these changes to your thinking and behavior, there are things you can do to help manage your stress. Practicing relaxation activities such as yoga, meditation, or deep breathing can help reduce stress, as well as eating a healthy diet and focusing on a full night's sleep. It is also important to avoid becoming overwhelmed and taking on more than you can. It is okay to say no. Do your best to stay positive by enjoying the small things in life, eliminating worry, and looking for the good in others and in yourself. Anxiety is a normal part of life, and many people experience anxiety at times. When we experience anxiety, it is our body's response to a threat or danger, and our body reacts by releasing adrenaline. Adrenaline causes our heart rate to increase and our blood to shift to large muscles. Once the threat is no longer there, anxiety will no longer be present. However, anxiety is a concern when a person continues to have worrisome thoughts or perceives something as a threat when there is no real danger. Everyone has different reasons or circumstances that may cause them to feel anxious or worried. However, there are certain things that can make our anxiety worse, such as medical conditions, including heart failure, addiction, or negative thinking. Anxiety can be more common in people who have a family history of anxiety or an imbalance in brain chemicals. Anxiety can cause our body to feel different and change how we think. Some examples of this include rapid breathing and heart rate, shaking, nightmares, amplifying a bad situation, needing others for reassurance and to feel safe, using alcohol or drugs to manage anxiety. When our heart rate and blood pressure increases due to anxiety, this affects heart failure. The increase in blood pressure and heart rate adds additional stress to an already weak heart. However, there are things we can do to be in control of our anxiety, such as mindfulness, activities, healthy eating, and sleeping well. Additionally, it is important to reflect on anxiety triggers and not worry about things we can't control. For more information about anxiety, please reach out to your local heart function clinic or family doctor. It is common for feelings of depression to increase after being diagnosed with heart failure. 5 to 7 out of every 10 people living with heart failure will experience an increase in depression symptoms. It is important to be mindful and recognize changes you may be experiencing in your mental health. Some signs to watch out for may include constantly feeling sad, feelings of hopelessness, little or no interest in people or activities you enjoy, thinking about hurting yourself or dying. Depression can be caused by one of many factors and can have a negative impact on how you manage your heart failure. Depression can affect your heart failure by making it harder to do the things that you need to do to best manage your condition, such as walking, eating well, and taking your medications as prescribed. There are things you can do to feel better and help depressive symptoms you may be experiencing. The next section of this video will cover things you can apply to your everyday life in an effort to manage depression. Setting small goals. Take a shower, go for a walk, do the laundry or the dishes. Try to stay social. Spend time with your family and your friends, even if you may not feel up to it. Recognize and avoid negative thoughts. Problem solve. Identify, take action, and reflect on the problems you may encounter. There are different approaches to treating depression, and it is important to get medical treatment. If you feel that you are depressed and need help, reach out to your local heart function clinic or your family doctor for assistance.